Is now starting. All attendees are in listen-only mode.
Hi all. Thank you for signing up to attend the 2019 WAPC Board Orientation. You're all in listen-only mode, but I just want to make sure that everybody can hear me and see my screen. So if you can, please raise your hand. Great. All right, looks like people can see me and hear me. Okay, great. If at any time anybody has a question or anything you want to add or share, please either just raise your hand or use the chat or the question box in your little the little GoToWebinar pane, and Barb will be keeping track of those questions and chats and hands. So all right, we'll just get started. So first of all, I just wanted to say congratulations to all the new board members, and also just a very deep thanks for serving on our board. It's can be another professional obligation that you might have, and we just are really appreciative that you've decided to spend some of your time working with us to improve perinatal care across the state. And I'm just going to go through and unmute everybody so that we can do introductions quickly. I think we're a small enough group that we can go ahead and do that. So I'm just going to unmute everybody. It looks like I'll unmute actually one at a time. So Lisa, do you want to go ahead?
Hi,
just share your name and your role on the board and where you work.
Yeah, I'm Lisa Locken. My role on the board is as the chair for the Perinatal Data Committee, and I work at Ascension St. Joseph in Elmbrook in southeast Wisconsin.
Great, thanks, Lisa. Kim? And I've unmuted you on my end, but you may be still muted on your end.
This is Kim. Are you looking to talk to me?
Yes, yes. Can you just share your name, your role, and where you work?
Okay. This is Kim Seeger-Langley. I am currently the physician rep for the Fox Valley and the president-elect for WAPC. And I am employed by the Medical College, and I work at St. Elizabeth's Hospital in Appleton in the NICU.
Thanks, Kim. And Melody Bunting is on here. She's not in a place where she can talk right now, but she is the new treasurer of the Perinatal Foundation and one of the representatives to the WAPC board. So we welcome Melody. And Rebecca?
Hi, this is Becky Kirkenbush. I'm a clinical dietitian at Watertown Regional Medical Center, and I'm an allied health professional representative.
Thank you. And Sarah?
Hi, I'm Sarah. I'm a pharmacist at Meriter Hospital, and I am chair of the Preconception and Perinatal Care Committee.
Thanks, Sarah. And Stephen, I don't know if you're if you have audio right now, but I'll go to Beth. Beth Dibbert.
Hi, everybody. Beth Dibbert. I'm Chief Quality Officer at the Wisconsin Hospital Association. I'm not really new to the board, but attending orientation just for a refresher. And there are a couple of sort of, even though not clinical in nature, but WHA is one of the consumer sort of groups or advisory groups that are adjunct to the board.
Great. Thank you. All right. Thanks, everybody. All right. Well, we'll just move through this. As I said, please feel free to ask questions throughout. If anything comes up, please feel free. So this is just a very brief overview of WAPC. We were founded in 1970 on the idea of regionalization to make sure that there was adequate and appropriate care across the state. We're the entity that certifies maternal and neonatal levels of care for the state. A lot of our work involves provider education and collaboration across disciplines and across systems. We also create materials and resources to support the work that providers do in supporting their patients and improving quality care across the state. And we're funded through grants and the support of the Perinatal Foundation. We're also a member of the Wisconsin Perinatal Quality Collaborative, WISPIC for short. And I will go through the relationship between the Perinatal Foundation and WAPC and WISPIC and WAPC later on in this presentation. So membership in WAPC is individuals. Anybody who is working anywhere in the perinatal world is welcome to join. So it's intended for professionals that do any kind of work that touches on the perinatal period or families and the perinatal period. So we are primarily nurses and physicians and people who practice in a clinical setting. But we welcome and are looking to encourage more membership in other fields as well. We do have we have 50% of our pharmacists on the phone right now, and we would love to expand to other professions that work in the clinical setting, but also to people who work outside of the hospital setting. So social workers and home visitors, anybody who's working in that world. And as you can see, membership is very affordable for a professional organization. It's $75, and we've just moved. We used to be, for members for longtime members, we used to be on a calendar year, but we switched last year to an annual membership so that you really get the most value from the day that you join. You'll get that full year. So it doesn't matter if you join what time of year, you'll get that full year of membership. We do offer student memberships as well. So they're $40 for a full-time student. And that membership, unlike I think a lot of other professional organizations, the student membership at WAPC has exactly the same access as regular members. We do also want to show how we have valued the long-term commitments of members who've been with us for many years and are now fully retired. So we have a lifetime membership. It is free, permanent, very exclusive, invite only. But if for our members who are now fully retired, they've been a member for 10 years, doesn't have to be 10 consecutive years, but 10 years, you're invited to become a lifetime member. And that has all the same benefits of a regular membership as well. And our current membership right now is $355. And so these are some of the member benefits. You do get discounts on webinars and conference registrations and different leadership opportunities. But for me, I think that the main benefit of becoming a WAPC member is that we are the one organization in the state and in a lot of states actually, where you can come together to tackle complex problems with a multidisciplinary approach. So there are a lot of professional organizations that people are able to join, but we really try to break down the silos and look at the complex issues that we're all working towards, and bring together all of our skills and knowledge, knowing that there's really no one profession that can solve some of the larger issues we have with maternal mortality and morbidity and infant mortality. So this is really an opportunity to be able to work not only with people from different disciplines that can support the work that you do and support your knowledge in the field, but also statewide. So we can work with people all over the state that may have similar issues to you, and you can work together to solve some of those problems. So I'll get into some of the nitty-gritty of board leadership. So the board manual is available online through the members only section of the website. Your username is your email address and your password is webinar. And that is that information comes through whenever anybody joins or renews. That's in your confirmation email. But if you have any issues accessing the members only section of the website, feel free to contact Barb for support around that. We do have future plans to combine the board manual into one PDF and email it to the board. It'll also be available through the board-only section of the new member portal that we're hoping to roll out in the fall, and I will share more about that member portal in a few slides. Does anybody have any questions before I step forward? Okay. So just going to go over the leadership and the structure of the board, and I will show you just the overview. It's probably a little small to see. The roster for the board of directors. And as you can see, we have a couple of vacant positions, and I'll share that in a second. So the leadership and structure of the board is made up of the following sort of groups of board members. So we have the executive committee, the regional representatives, the consumer representatives, the representatives from professional or consumer groups. So the difference between those two is that the consumer representatives are individuals who represent or who have some experience or close work with the perinatal field. And the representatives from the professional or consumer groups represent, they're the representatives for the whole organization. So in a way, it's the organization that is the member. So Beth mentioned that she represents the Wisconsin Hospital Association. So Beth is the representative from that professional group, the WHA. Board members are also include the chairs of all of the program committees, and we'll go into those committees in a couple slides. We also have the representatives from the Perinatal Foundation to WAPC, so those are Perinatal Foundation board members. We have Melody on from the foundation as a representative to WAPC. And then we have representatives from WAPC to the Perinatal Foundation. And I'll go into that relationship a little bit more about why we have those representatives on each board. So these are the program committees and their chairs. We are looking to add, we don't have right now, but we're looking to add a postpartum care, postpartum practice committee in the future, the near future. The prenatal testing chair position is vacant, so if anybody has a passion for prenatal testing or knows somebody, please let us know. And these are the administrative committees or the governance committees of the board. And then these are the positions that hold the chair role for each of these committees. So we've got the annual conference planning, calendar award, executive, the nominating, the strategic advisory, bylaws, regional forum planning, and the liaison working group. And the liaison working group is the committee that sort of spans the WAPC and the foundation, since there is some overlap with staffing and budgeting and work work there. Any questions about what any of these committees do? The charges we will send out to everybody because we have a whole list of the committee charges that will clarify some of the roles and distinctions between them. All right, so the way that we do elections and support leadership, the full membership elects the president-elect and the consumer representatives, and the regions elect their representatives. So each region has a physician representative, a nurse representative, and an allied health representative, and they rotate each year. So each year for the regions, they're only electing one person. And so each rep will serve for 3 years. So it's staggered like that. Within the board will elect their secretary and their treasurer, and that will alternate by year. So 1 year will be secretary, 1 year will be treasurer. Board also elects the professional or consumer organization, as well as the WAPC representative to the Perinatal Foundation. And then one thing to note, and this is important for thinking about leadership development, is that the WAPC president, or president-elect, I guess to start, must be or have been a member of the board of directors. So here's some of the responsibilities and expectations for the board members of WAPC. So first and foremost, board members must be a member of WAPC. It's required that board of directors attend and be prepared for board meetings. There are 2 a year, one in November and one in April. And the April board meeting is at the annual conference. So we kind of try to make it as easy as possible to fit that in and attend the annual conference. And those are both in person, but we realize that we have very busy and want very busy representatives. So if in person is not an option, we always do our best to make calling in possible for people. The board of directors is also responsible for approving financial materials. So that would include approving the budget, reviewing and approving the 990s, as well as the audit in the spring. The board also approves any bylaws changes as recommended by the bylaws committee. And then it's expected that the board of directors will share information and connections that they might have pertinent to the work of WAPC. So we are very fortunate to have a wide variety of members with different networks and experiences and roles within the perinatal world. So we really value that and want to be able to bring any resources or any information that board members have to better serve the perinatal community. And then another expectation is to promote membership through colleagues and networks. We have probably our best work is through word of mouth. We have a lot of members who are especially on the board, who are very active in promoting membership to their colleagues and people they think that might be well suited for a particular committee is also really helpful. So we really rely on our members and particularly our leadership on the board to promote membership and explain the value of WAPC membership. And then some suggested expectations and responsibilities would be to attend as many WAPC events as is possible. The annual conference is, of course, our big one. It's also the board meeting in April, so that's one that is kind of a biggie. But we also have other in-person events throughout the year, as well as webinars, which would be great to have attendance on. But we have regional forums throughout the state. So hopefully, even for folks that are further out, maybe Madison or Milwaukee is not accessible all the time, we have those regional forums that hopefully are more accessible to the board statewide. It's also suggested that the board of directors support the work of WAPC through supporting the Perinatal Foundation. We've been thinking quite a bit as staff about the annual conference, and we've been focusing a lot on exhibitors. So I thought I'd throw this in, that it's important for exhibitors to see the investment of the board of directors and to see a return on their investment in attending the annual conference, so exhibiting at the annual conference. So we encourage board members to talk to exhibitors, learn sort of what they're working on, and then also to solicit or at least share with us some ideas for exhibitors and sponsors for the annual conference. So finances are a large part of the board's role, so including reviewing and approving the annual budget. I will bring that up. Where did it go? Oh, there. And so this is the 2019 approved budget. It was approved at the November 2018 board meeting. And so at the board meetings, we will review the income and expense statements and just our progress on meeting our targets for the budget. And then I'll answer any questions, or our treasurer will answer any questions that the board has. So one aspect of board service is monitoring and approving the budget. Oh, sorry. And so the responsibilities of the board throughout the calendar year, in November, it's when the annual budget is presented for a vote, and then the board votes. In April, the audit is presented by our auditors, SVA. And then also sometime in the spring around that same time, the 990s are reviewed and approved by the board. So this is pretty common for board service, and I think a lot of when people are joining boards, they're thinking about the fiscal responsibility, but we also have directors and directors insurance, so that there's no liability for board members, which is an important thing to note. And then our funding sources. So we are very lucky to currently have 3 outside funding sources, grants, and then support from the Perinatal Foundation. So I'll just run through them really quick and kind of some of the activities. The DHS opioids grant that we received was to focus specifically on opioids work, and to provide a grant to another organization to implement a model of care that would hopefully be something that could be expanded throughout the state. So we worked with Marshfield Clinic in Minocqua to create a doula program focused on supporting people who are experiencing substance use during pregnancy. And that grant will be closing up at the end of at the end of August, and we will have a symposium. Sorry, it's closing at the end of September. We'll have a symposium that there'll be details more on a different slide. We also have a grant from the CDC to support WISPIC. the Wisconsin Perinatal Quality Collaborative. So that grant supports the quality improvement manager that we have that works on WSPIC work, and the grant is really intended to build on the infrastructure of WSPIC, build on the data infrastructure as well, and then support 3 initiatives. So around the first initiative is around improving the care of infants with NAS/NOWs. The second is to improve identification of women with opioid use disorder. And then the third is to improve the care of women with opioid use disorder. And so that's a 5-year grant, and we are in year, coming up on the end of year 2. We also are waiting to hear back on a supplemental grant to support that same work, very specifically with opioids, in year 3, and we hope to hear very soon, as it will start in September as well. And we also work with DHS in another capacity with support of Title V efforts through the MCH Title V block grant. And that grant supports work in 5 areas: in human milk feeding, smoking cessation, safe sleep, well woman visits, and a 5th one, and I can never remember the 5th one, and it's always a different 5th one that I can't remember. It'll come to me. And then we also enjoy quite a bit of support from the Perinatal Foundation that supports program work and staffing and operating expenses. So WAPC was founded on the concept of regionalization. So we have divided the state into 7 regions, and here they are, this beautiful map. And to the right of the map are the regions listed out and the number of members in each region. So as you can see, the weight of membership is really in the South Central and Southeast regions, but we've been working on how we can invigorate the regions across the state and really support membership and activities in each region. So right now we offer the Regional Forum Series. This year it's on depression in the perinatal period. And so we will have the forums in each region organized by the regional reps. And right now that's the only in-person activity that we have, but in the past regions have organized themselves to sometimes have even just like a day conference or their own networking opportunities or get-togethers, and so we're really looking to support that. You know, we know that membership values the, or at least we know from some folks that in the past it's been one of the benefits to move to another region and know that you can get in touch with WAPC members in that region and be kind of connected to a community that you're already kind of familiar with, and sort of be welcomed in that way, so professionally anyway. So we would really like to have that be something that people cherish once again. So the next 2 slides, I'm going to talk about the relationship between the Perinatal Foundation and the relationship between WSPIC. So all of the activities I'll be talking about are going to be very specific to WAPC, but staff and our sort of big sort of concerns overall might either overlap with the Perinatal Foundation or WSPIC or be just sort of separate from. So the relationship between WAPC and the Perinatal Foundation is longstanding. The foundation was started in 1985. So they'll be celebrating their 35th anniversary coming up, actually, in 2020. And the Perinatal Foundation supports the work of WAPC in not only sort of directly through funds, but also through creating working towards sort of an environment that supports the perinatal workforce and just a positive environment for perinatal work to flourish. In addition, so WAPC is a nonprofit and it would be allowed to fundraise, but we don't fundraise. All fundraising goes through the Perinatal Foundation. There is a memorandum of understanding that, so it's a legal document that connects the two organizations and really explains that relationship. And that will be in the board manual that board members will get. Each organization has representatives on the other's board. And that's because so much of the work is in service of the same goal, and staff at WAPC supports the work of the foundation as well. The foundation itself, as an entity, does not have employees, but WAPC's staff are the staff for Perinatal Foundation as well. Any questions about that relationship? I'll move on to the Wisconsin Perinatal Quality Collaborative. So the Wisconsin Perinatal Quality Collaborative is an independent statewide collaborative working on supporting quality improvement statewide. The membership is made up of organizations, and two of those organizations, those founding organizations, are WAPC and the Perinatal Foundation. So I know that there's sometimes some confusion about what the distinction really is between WAPC and WSPC, and probably that has a lot to do with staff being quite overlapping. But WAPC is the fiscal agent of WSPC because WSPC itself is not a separate legal entity. It does not have 501c3 status. It truly is just a collaborative of like-minded organizations working together to improve the quality of care throughout the state. So WAPC is the fiscal agent, but it does not control the direction of WSPC at all. WSPC has its own steering committee, its own membership, its own operating principles, and WAPC staff really just facilitate the work, facilitate the meetings, you know, and do the event planning. So, you know, we always say internally, if WSPC decided to establish itself as its own organization or hire its own staff, it would be well within its rights to do so. WAPC is the organization that applied for the grant to build the data infrastructure. So again, we are the fiscal agent. WSPC doesn't currently have its own staff, but this list here is the staff that currently support the work of WSPC. And so all of those folks listed, some percentage of their time is dedicated to working on WSPC. The exception is Christine, our Quality Improvement Project Manager. That CDC grant that WAPC has fully funds her position to work exclusively on WSPC. So she is the unique staff member who only works on WSPC, whereas most of us work on each of the three organizations. Any questions about that? Okay. So this is just a visual of the same thing. So you can kind of see that Perinatal Foundation and WAPC overlap, but WSPC is off sort of to its own. But WAPC staff is sort of the connection between all of the organizations. So it's WAPC staff, but they support the work of both of the other organizations. So I just wanted to give you an idea of some of the major internal WAPC projects that we're working on. I'm just going to share the ones that are strictly WAPC. So staff have a lot of different projects that they're working on, but I'll just share the ones that are specifically WAPC alone. So one big theme of major projects are the projects related to membership and leadership development. So we've been working on with the board, so in sort of incorporating the feedback of members and of the board members, we've kind of come up with this plate of strategies for increasing membership and supporting leadership development. One big way is through the establishment of a member portal. And there's a nice like 3-minute video on your membership, the member portal that we chose. And unfortunately, you could only see it and not hear the sound, so it's not really worth it. But we can maybe send that link out if you'd like. So the member portal is just going to be a way, if you've heard me talk about this before, you're probably sick of it, hearing about it, but the member portal is going to be the way that we can quickly communicate with members, automate so much of our communication and our membership renewal notices and things that right now Barb is doing by hand. And so the member portal is really going to not only connect members quite a bit more independently, so they'll be able to do a lot more by themselves in terms of connecting with other members, but also it'll free up a lot of staff time that's currently devoted to just sort of hand doing a lot of those processes that can be automated. The new website, it's a Brand Plus website. It's connected to the member portal, so they'll go together. We are very excited about that. The new website will also have the option for what they call sort of a microsite. So it'll make, we'll be able to do events, particularly the annual conference, as a connected but its own sort of site that will allow people to register much more easily and sort of see all of the options that they have for registering for different sessions, just much more simply. And then that will also be connected to the member portal, so people will be able to see what they've registered for. So we're very excited about those things, those two pieces. We are shooting for a rollout of sometime in the fall, and staff has been working really diligently weekly on that project plan. So it's we're very excited about it. The next piece is looking at a learning management system. So the one that we've got now, we're thinking of moving to one that can be integrated with your membership. And so that when members look into their member portal, they'll be able to see what they've registered for, what they've already completed. They'll be able to see any completion certificates, do all of their everything related to learning management within their member portal. So we're very excited about that as well. Again, it'll save a lot of staff time and membership participant time too. So we're very excited about the possibility of a new LMS. We've also been working quite a bit, and this is really in response to the great sort of thinking of the board of directors who have shared what they need, what they'd like to see from us. One of those things is supporting committee chairs. So, and I should say program committee chairs. So we have been working on how staff can support the work of the committees through some kinds of standardization and just some sort of shared understanding of how we're going to move the committees forward. But the big thing that we're excited about is that we will have, I think we're thinking possibly quarterly meetings of the committee chairs so that they can come together and talk about what it is to be committee chair, what kind of support that they need. But then also, and a big one for us, is they can talk about the work that they're doing and then align it with either other committees or just make sure that it's aligned with the rest of the work of WAPC and the action agenda that's set each year. So we're very excited about that. And then the next step would that we're hoping for is to take some of that sort of model of supporting and organizing the committee chairs and map that onto the supporting the regional reps. It'll look a little bit different because their needs are different, but we're hoping that by increasing our support and sort of transparency of what is required of regional reps and what's possible to do within a region will not only help us build that leadership, but also it'll have the trickle-down effect of revitalizing the regions as well. When membership in each region has just more connection to WAPC as a whole. So we're very excited about that. And then we've been thinking a lot about, and the board so far has been talking quite a bit about transparent paths to leadership. So basically just making it very clear how you can become more involved with WAPC. And then, you know, if you're a new member and you come to the annual conference and you're really geared up, you're very excited, you want to jump in, and how do you become the president? We make it very clear what that path is and how you can do that. And some of that is just sort of promotional materials or ways that we structure different events, especially the annual conference. Some of that will also just be the accessibility of organizational documents and things like that in the member portal. So there's a couple different ways that we're working towards that. But we're very excited about that. Membership is, I think, always on everybody's mind. I put membership and leadership development together because I think that the two just really complement each other. And if you're doing one, you're doing the other as well. So the other major internal work that WAPC is doing is really around event planning. Our three big events coming up are, you know, I don't know how big it is, but it's just the 50th anniversary annual conference. So we are very excited about that, spending a lot of time thinking about how we can make that a really enjoyable celebratory time. So we're very excited for that, doing a lot of planning. We're also working to solidify the dates of the 2019 regional forums. So last year was human trafficking as it relates to perinatal care. And we knew that it was going to be such a large topic. I mean, they all are, but we knew that it was going to be such a large topic we wouldn't be able to cover everything in those short sessions. So we had planned to do a 4-session webinar series the following year. And that was a really good model that we liked. So for 2019 and 2020, we're going to follow that same model. And so the 2019 regional forums are on mental health in the perinatal period. And the planning committee is going strong for that. So we intentionally wanted that to be a broad enough topic that people could narrow it down and kind of really think through a unique topic that is maybe not talked about as much within that theme. And then we'll follow up with a webinar series in 2020. So that planning committee will be thinking through that as well. And then related to our DHS opioids grant, we will be organizing the opioid symposium. So staff time is being thrown into that as well. So these are the upcoming events, virtual events that we have. These are all on the website, and we have brochures for each of these and have sent them out for to members to our database. So if anybody is interested in joining any of these, we welcome you. There's a fee for the human trafficking and the fetal monitoring, but Safe Sleep webinars, that comes from the support of our MCH Title V block grant. And those are free, and those have been just super well attended. Some of our best attended Safe Sleep, or some of our best attended webinars, and so we've been really lucky to have that support from the that grant. And then the in-person upcoming event, the big one, annual conference. Please save the date, April 26th to 28th at the Osthoff. And there's a picture of the beautiful Osthoff in Elkhart Lake. And then the opioid symposium, we are waiting to hear back from the venue, but it'll be 14th or 15th of August in Wausau or thereabouts. Might be in Rothschild, which is, basically Wausau. And the 2019 regional forums, they are in September and October, still in the planning stages. So we'll get those dates out to everybody once that's set, and the locations as well. And then the next board member meeting or board meeting is in November. So it's November 15th at the Osthoff. So you'll get a sneak preview of what you can expect if you haven't been before. So that is the end. This is my contact information. If anything ever comes up, or if you have any ideas that you want to share, or any questions about anything WAPC, please contact me anytime. We will be sending out a very short, I promise very short, survey in your email about the orientation so that we can get a better idea of what was helpful, what you'd like to know more about, what you'd like to know less about, and just so that we can improve it for years to come. This is I think the first one that we've done since 2016, so it will be great to have some feedback from everybody about what worked. And are there any questions that anybody has for me? Anything that you thought I'd cover that I didn't? Okay, looks like that. Well, I just want to thank you all for taking this time to attend the orientation. I know we've got some new people, but also some returning people, and I just appreciate everybody sitting with us and reviewing what the board is all about, what WAPC is all about, and just more generally, thank you so much for the support that you give to the organization overall. We really value our board members, and we feel very fortunate that you're all working with us. So thank you very much, and we'll see you in November, if not earlier.